Margot, we do something called B-side report, which means at the end of my shift, I will come in with the oncoming nurse and introduce her and discuss your plan of care. Does that sound okay?
Sure, that sounds great.
Alright, if you're sleeping, we only wake you if you'd like us to.
That would be fine with me.
And we ask your family members to leave unless you consent for them to stay.
I would like my daughter to stay.
Okay, you can expect a staff member to come and check on you and make sure you're prepared for B-side report, and we will be back in shortly.
Thank you.
Before we go in, Margot had a scan of her chest early this morning, and it showed some abnormalities that she is aware of. Dr. Fahri will be up later to discuss those results with her. Just now she is nervous.
Okay.
Hello, Margot. My shift is coming to a close and it's time for B-side report. This is your new nurse, Intan. She is a great nurse. I'm leaving you in very experienced hands, and this Audrey, Margot doctor.
Nice to meet you both. I'm replacing Sandy and I'll be with you till 7 a.m.
We're gonna start reporting, also feel free to add any information or ask any question. Margot Carly is 56 years old, that came through the emergency department and admitted for pneumonia.
Okay, Margot, can you please state your full name and date of birth?
Sure, Margot Kelly, 626 is go.
Thank you.
Margot presented to the emergency department early this morning with difficulty breathing, cough, and chest pain. She had a room air oxygen saturation of 84%. She has a history of a recently treated pneumonia, and we are currently giving her IV antibiotic and IV steroids through a PICC line on her right side that was placed this morning after multiple IV attempts. She also has lactated rangers running at 125 hours.
Okay, Margot, I'm just gonna check your PICC line here at 125.
She was given a narco for pain about 2 hours ago. How was your pain right now?
I would say it's about a 3. I'm feeling much more comfortable talks.
She has also been started on breathing treatment. She recently had a nap. Did you find that effective?
Much better. I was feeling really short of breath earlier, but the treatment really helped.
Your hospitalist, Dr. Fahli, will be in later this afternoon to discuss the result of that CT scan.
Okay.
Margot did have an X-ray and CT of her chest and is looking forward to discussing the result.
Okay, Dr. Fahri is great. He does a good job in answering questions and will address your concern while he's here. When I'm done getting shift report, I'll check on the status of when he's able to get here.
Thank you.
Margot has an oxygen saturation of 93%. On 3 today we are titrating 292. Her oxygen demands did increase while she was up. She walked the hall twice and did well. She's tolerating her cardiac diet, although our appetite is part sheet of BM this morning and is fighting fine.
Okay, how are her labs?
She does have a white count of 12, which indicates an infection. Other than that, her labs were fine, and she has a VTE score of 6. That's the risk for a blood clot. She's got the compression sleeves and medication ordered for prevention.
Okay, I'm just gonna be checking your STDs.
Okay, talked.
She's had a moderate fall rise with the yellow socks and wristband in place, and she's been using her cold aid appropriately and gets up well with one a size.
Ben and we have a public grid.
Okay, that ends my shift report. Any question, Intan?
No, thanks for a great hand of all.
Alright, any question, Margot?
Nothing I can think of.
Margot, you can expect to within an hour for your assessment, and then I'll check on you hourly through the night. Be sure to use your cool light when you need to get up to use the bathroom or for any other needs you might have through the night, okay?
Okay, thank you.
Okay, Margot, I'd like to update at this time. Is there any shift goals that we can add it this time for you on with you besides talking to Dr. Fahri?
I would like to get some rest this evening.
Okay, Margot, thank you for letting me take care of you today. Intan will take over now, and I will be back in the morning.
Okay, good. It looks like your table is within reach and there's a clear path to the bathroom, so just be sure to use your call light when you need to get up to go to the bathroom or for anything else you might need.
Okay,
Thank you.
thank you, girl.